Type 2 diabetes. What triggers it and is it reversible? Well, there are many triggers, but the primary trigger is eating too many carbohydrates. Why is that? So when you eat a meal, your blood sugar goes up and your pancreas has to release insulin in order to bring the blood sugar back down. Insulin literally binds to a receptor on your cell membranes and opens a little door that allows glucose to leave your bloodstream and go into the cell where it can be utilized for the production of energy. And what can happen if you eat too many carbohydrates is that there's always a lot of insulin being produced to combat that, and the receptors get less and less sensitive to insulin over time. So then what ends up happening is it takes more and more and more insulin to control your blood sugar until one day all the insulin your pancreas can possibly pump out is not enough to control your blood sugar, and you flip into diabetes. In the meantime, you have insulin resistance, which creates a whole host of other problems like belly fat deposition, high cholesterol, higher blood pressure, more inflammation in the body, rapid aging. But eventually, you develop diabetes, which puts you at a risk for a whole host of other problems like heart disease and stroke, cognitive decline, loss of limbs, vision loss, kidney failure. The list goes on. So, this is a very important disease to prevent if possible, and if you develop it, to work hard to reverse it. But it is reversible in most cases. So, what can you do? Well, you can reduce the consumption of carbohydrates, and you can increase exercise, and you can ingest supplements that have been shown to enhance the sensitivity of insulin receptors. So carbohydrate consumption reduction is a number one thing to do. So moving in the direction of a ketogenic diet, or at least a paleo diet, where you are primarily eating moderate amounts of protein, lots of green vegetables, and healthy fats, is the way to go. So that is going to very quickly kind of lower your blood sugar, which will lower the amount of insulin that needs to be produced to handle that. And it will begin over time to resensitize the insulin receptors so that it then in turn takes less and less insulin to control your blood sugar, and you can reverse diabetes that way. The other thing that's been shown to be incredibly important is exercise. Now, this is pretty basic, but even walking 5 days a week for 20 minutes or more has been shown to be very good for insulin receptor sensitivity. But certainly doing some of the research types of exercise like high intensity interval training can be even more effective. So exercise 5 times a week or more will really, really help. From a supplement standpoint, maybe a lot of you have heard about chromium picolinate. Well, it's a very dose-dependent trace mineral, and a person needs 1,000 micrograms a day to help enhance the sensitivity of the insulin receptor. But we now know vitamin D is very important in optimizing your vitamin D status. Vitamin E can be helpful. Lipoic acid, like 100 milligrams a day, can be very, very helpful. And balancing your hormones. So the hormones that I often talk about that are made by the adrenal cortex, like DHEA and pregnenolone and the metabolite testosterone, have all been shown to enhance the sensitivity of the insulin receptor. So we want to optimize our hormone balance, make sure we don't have an undiagnosed thyroid problem, reduce the consumption of carbohydrates, and increase exercise. And if you'd like, add in some of the nutrients that I've just discussed to enhance insulin receptor sensitivity. And usually this will take care of it. Now, once in a while, someone benefits from adding in a pharmaceutical like metformin. Metformin will enhance the sensitivity of the insulin receptor, and lead to it needing the body needing less insulin to control the blood sugar. So it can be very helpful, and you can sometimes get off of it. So it can be helpful for a period of time while you're working on all the lifestyle changes I've just discussed. Then eventually you can get off metformin and still do very well. So anyway, I hope all of that helps, because it is so important to turn this disease around. You turn the trajectory around, you're going to have a much better life.